today's run of show, we will start with Mayor Jenny Durkan, who will open us up with some opening remarks. We'll then hear from Director Patty Hayes, King County Public Health, followed by Jake Scherf, CEO of the Seattle Visiting Nurses Association, and then Dr. John Lynch, Medical Director of Harborview Medical Center, Infection Prevention and Control and Employee Health. After that, we'll do some Q&A, and we will moderate that as we normally do. So with that, I will hand it over to Mayor Jenny Durkan.
And I want to say hello to everybody and just thank the three people who are here on the panel with me that you're going to be hearing from. Patty Hayes, John Lynch, and John Scherf. They and their teams have just done remarkable work over the last 7 months to get and make sure that Seattle and King County can be safe and stay safe under COVID. And now we're entering flu season. We've had flu seasons before, but this year's flu season is probably one of the most treacherous for our region than we've had before. That's because we're in the middle of a global pandemic for COVID-19, and the flu perfectly disguises itself with almost the same symptoms. We also know that because of the flu, our hospitals and doctors' offices get really busy this time of year, taking up a lot of the capacity that we may need for COVID if there's an upsurge. And so as we navigate the future, we're going to be asking everyone to really be vigilant. Our city is doing better than almost every large city in America. That's due in part to the people that you see before you today, the people at Harborview and the first line healthcare workers, the visiting nurses, Patty Hayes and the other public health officials. But really it's because the people of Seattle and the people of this region have done what we've asked them to do, to make themselves and keep themselves safe and to make their neighbors safe. And so we're going to be asking you to do more in this flu season to make sure that we can keep people as healthy as possible. To help in this effort, the City of Seattle is partnering with the Seattle Visiting Nurses Association. You're going to hear from Jake on what they're doing to provide nearly 3,800 free flu vaccinations for people in the City of Seattle who are uninsured. Beginning tomorrow and on Friday, October 31, also known as Halloween, the City of Seattle will host vaccination clinics from 10 a.m. to 5:30 p.m. at Genesee Park in South Seattle. We will have language access available for people. We use some of our CARES Act funding to purchase the vaccinations. And over the next week, dozens of clinics will be hosted from the Central District to Southwest Seattle at Seattle Public Schools. Seattle Public Schools rolled out that announcement yesterday. Again, those are part of the program and those are free vaccinations for people. This is all in partnership with Seattle's Visiting Nurses Association to make sure that we can make sure vaccines are free and available for those people who might not be able to avoid them, obtain them otherwise. We've had to look to our resources here in Seattle and King County and the state because we haven't had the level of federal leadership that we need. And this is one of the ways we step up to show that we care for each other and will take care of each other. Jake from the Seattle Visiting Nurses Association will be sharing more with you on that front in a little bit. I can't stress enough how important it is for you to get your vaccination this year. And you're going to hear this over and over again from these speakers, and hopefully every time you turn on the radio or TV or out and about, getting your flu shot is critical. I got mine. I would recommend getting it in your non-dominant arm, and if Russell Wilson gets his, don't get it in your passing arm. But we need people vaccinated. We need more and more members of our community to be vaccinated this year than we've ever done before. Last week, City of Seattle, as an employer, launched its flu shot clinics, and we're offering two types of clinics for our employees. Our essential staff clinics are for employees who are required to show up and continue to work on the front lines at our city. And our all staff and family clinics include employees who regularly are teleworking and their families. We want everybody to be safe. UW Medicine has launched a program and campaign for their employees. And I know King County is doing the same. If you're an employer and you're setting up these programs, please, please, please let everyone know where they can go to get vaccinated. Together, as a community, we can get more people vaccinated than ever before. That means fewer people with the flu. That means fewer people end up getting hospitalized, and we don't put that pressure on our frontline workers. It also means that your immune system isn't compromised making you more susceptible for other respiratory infections like COVID. So as a city, we are one of the first to be hit by COVID-19, but we pulled together and we did some remarkable things. First, we stayed home, then we masked up, and we're still doing that to keep people healthy and safe. We have to keep working together as a city and a region. And one of the ways we're going to be asking you to do that again is to get your flu shot. Next, you're going to hear from a person who's just been a tremendous partner the whole time I've been mayor, but particularly this year as we have faced this unprecedented health situation. And that's Patty Hayes, who's the director of Seattle King County Public Health. She spearheaded our COVID-19 response in this region, and I can't thank her enough for her leadership. I don't know where she gets her energy and how she keeps doing it, but she always shows up and gets it done. And now she's going to talk to you about the flu and flu vaccinations. Patty, it's all yours.
Thank you, Mayor. So appreciate it. And really, really glad to join you in this great event today. And encouraging, as you said, everyone to get their flu shot. I got mine last week. You know, as a public health official and a nurse, this is a topic that we talk about every year. But as you said, this is a very important year. You know, the flu vaccine's been around for over 50 years, and we know it's safe and it's effective. People who get vaccinated are less likely to become ill, or if they do get ill, they have less severe symptoms. So that's really good news for people who get vaccinated as well as those around them. Now, flu vaccine takes on even greater importance, as the mayor just noted, because of our fight against the COVID pandemic. We're expecting this fall and winter to be very challenging. Hospitals, clinics, and doctors' offices are likely to be busy in caring for COVID-19 patients. So we need to keep as much of that capacity available as possible. So getting a flu shot is an important way you can help us counter COVID. Not only will it help keep you out of the medical offices and hospitals, it will help save limited medical resources to care for COVID-19 patients who need it. You'll hear Dr. Lynch talk more about this in just a bit. To help you do your part, the city and county are doing ours. We're working to make it easy as possible to get vaccinated for the flu. As you've heard, the city is working with the Seattle Visiting Nurses Association, which is so incredible. And they're offering many drive-through clinics in the coming days. I'm so grateful for this commitment and to the mayor's work in this area. In the coming weeks and months, our department and healthcare providers across King County will be offering over 100,000 doses of free flu vaccine to uninsured and underinsured adults. In addition, our department is spending $900,000 in state and local and federal dollars to go above and beyond the usual flu season activities. This is by far the largest flu season vaccination effort our department has ever made. We will be emphasizing vaccine access to communities of color, particularly in South Seattle and South King County. Community partners are working with us and the cities to identify the most effective outreach strategies. In addition, we'll be reaching people experiencing homelessness with clinics at shelters, at encampments, and permanent supportive housing sites. Teams will also be doing vaccines at correctional facilities which are more vulnerable to outbreaks. Older adults are some of the most vulnerable to severe flu illness, so we'll be supporting flu vaccine activities both in and outside of long-term care facilities. All of our collective outreach efforts are on top of the existing flu vaccine channels, including pharmacies and medical offices, and you can find all those options at our King County website, which is www.kingcounty.gov/find-a-clinic. Together, we're determined to get a record number of people vaccinated this year. I also want to take just a moment to emphasize the importance of continuing our effort against COVID. As mentioned, we're facing another challenge this fall. Our case counts have been rising here and actually across the entire country. And they could go much higher if we all don't continue to do the right things, as the mayor said. I know distancing and mask wearing is really hard and we're all tired of it and fatigue sets in. But let me tell you, it's more important than ever and lives depend on it. Please help each other out by wearing a mask inside and out. Keep your distance, keep your group small. We can all be heroes together. Now it's my delight to introduce Jake Scherf, CEO of Visiting Nurses Association. Thank you for your partnership, Jake, and I'll let you take it away.
Thank you so much, Patty. I really appreciate all the kind words from you and from Mayor Durkan as well. I just want to give a brief introduction of the Seattle Visiting Nurse Association. Many of you probably know us from clinics that we typically do for employers, government agencies, and our longstanding partnership with Seattle Public Schools. So this year, to meet the needs of our clients during the pandemic and in the region as a whole, we set up a series of drive-through flu clinics all across the city in partnership with several different school districts. In the past 5 weeks, we've been able to vaccinate 30,000 people, which is quite the accomplishment for us as an organization. And we're hoping with our next couple weeks of clinics here in partnership with Seattle Public Schools to be able to reach another 10 to 15,000 residents in the city. So I just want to talk a little bit about our registration process and sort of what to expect when you visit one of our drive-through clinics. You can go on our website, schedule.seattledna.com, and browse through a list of clinics to find the one that's most convenient for you. The scheduling website is modeled after Solve's portal, which the city uses for COVID testing. So if you've ever scheduled a COVID test through the city's website, you'll be pretty familiar with this process. Once you've selected the site you'd like to visit and pick your time, you can enter some personal information, and then you'll have an option to choose either insurance or no insurance. Whichever option you select, there is no charge to you as a patient. There's no copays, no deductibles, no out-of-pocket expense. Thanks to 2 generous grants, one from the city of Seattle and one from King County, we have funding for up to 14,000 uninsured immunizations this year. And we still have space for about another 10,000 uninsured patients, so we should be all set for the next couple weeks. Once you've registered for the clinic and you show up on the day of your appointment, everything will be done from your car. There's no need to get out of your car. You'll receive your immunization right through the window. In most cases, even during peak hours, we're talking about 5 to 10 minute waits. These are very family-friendly events. We encourage you to bring children if you have them, other family members, and you can invite your neighbors. Even though we are partnering with Seattle Public Schools, these are 100% public events. So you don't have to have a kid in school or any prior relationship with Seattle Public Schools to attend our events. We're really looking forward to these sites. Most of them are concentrated in South, Southeast, and Southwest Seattle. And we also have a permanent site running at North Seattle College to serve the residents of the northern end of the city. Really appreciative of all the work that Seattle Public Health Seattle King County has done, the mayor's office, and these generous grants we have to serve our uninsured participants. Looking forward to the next couple weeks of clinics, and we hope that you'll stop by. And to talk a little bit more about why you should get a flu shot and the importance of flu shots this year is Dr. John Lynch, Medical Director for Infection Prevention and Control at Harborview Medical Center.
Thanks so much, Jake. This is just an exciting conference to be on, listening to Jake's description of what they're doing at the Seattle Visiting Nurses Association, Patty's efforts on behalf of the county and the city, and Mayor Durkan's enthusiastic backing of all these activities. As an infectious disease doctor in UW Medicine, specifically at Harborview, I've been wrestling with influenza and its impact on patients and our community for a long time. And every season is unique. It's one of the major lessons I always talk about. And I think that, as Mayor Durkan mentioned, this year could be the most unique ever. We do not know what a flu season ever looks like until we are deep into it. And this year we need to prepare more than ever. One of the major things to take away from these conversations is that COVID, or what we call COVID-like illness, the way someone looks with COVID, can look just like someone with influenza. And so if we can prevent people from getting influenza, it is going to make everything much easier for Jake's teams, for Public Health County, for every clinic, hospital, emergency department, and office out there. So, when we think about influenza vaccination, obviously the most important thing to do is to keep people healthy, but it also keeps our population healthy. You've heard a lot about herd immunity in the community. The way we get to herd immunity is through vaccination. And this is a key way to keep our population immunity up. And then beyond that, within my facility at Harborview, to every hospital in the county and in the city and in the state, we need to keep beds available because we're looking at potential resurgent numbers in COVID-19. I think, as Patty's saying, we're taking a lot of good actions to prevent that from ever happening, but we have to pay attention to what's happening across the country. And so we think about preventing influenza cases. What we're really trying to do is keep people healthy, keep them out of clinics, out of emergency departments, and out of the hospitals so that we can use that space to take care of folks with COVID-19 should it arise, as well as all of the other important surgical and medical things that people need attention to in those same spaces. So when we think about just the impact of vaccination, I'm just going to throw some numbers out there because I think things that we sort of forget. Sometimes people point to influenza vaccines as being, okay vaccines or maybe not super effective. But I want to really get across that they are incredibly powerful tools for controlling influenza. When you look at prior years, something around the order of 4.5 million illnesses in the United States are averted because of vaccinations, 2.5 million doctor's visits, 58,000 hospitalizations, and nearly 4,000 deaths are all directly averted through influenza vaccination. You can decrease the risk of having to go to the doctor by up to half, right, by getting a flu vaccine. And this isn't just older adults, as Patty mentioned, folks at the extremes of age, less than 6 months of age, much older, and those folks are immunocompromised at the highest risk for bad outcomes with influenza. And they're also the folks in whom influenza vaccination doesn't really work. And so they're counting on healthy adults to get that vaccine and prevent infections in them. But we also have to remember that influenza is a little bit different. We're learning a lot about how COVID impacts children. Fortunately, we don't see as much of a bad medical outcome, but influenza kills children in Washington State every single year. And influenza vaccination keeps children healthy. It keeps them out of the pediatric emergency departments, keeps them out of the pediatric ICUs, just like adults. So influenza vaccination protects you, but it protects everyone around you. Just like Patty was talking about with masking protects you and protects everyone around you. And getting a vaccine is the same sort of community-oriented tool that we can put into place. So what is UW Medicine doing about this? Well, we're doing what every hospital in the city is doing. We are making sure that our employees have easy, free, accessible access to vaccines. We've been doing this at UW Medicine for a long time. We have incredible outcomes with our frontline staff. All of our employees at UW Medicine, we're up around 98% last year of all UW Medicine folks are getting vaccinated. And obviously we're thrilled with that. We also have been doing a lot of work this year because of the COVID pandemic and a lot of concern about what this winter looks like to make sure that every patient gets access to a vaccine for any type of appointment, not just primary care, not just for the family medicine appointment, not for the wellness check, but say you show up in any clinic that you potentially get access to it. And the last thing I'll just mention, and I'd love to hear what Patty and Jake were talking about with vulnerable populations, because one of the really cool things that we've done in UW Medicine, this is really led by our emergency department colleagues, nurses and doctors alike, is making influenza vaccination accessible to people who are currently living homeless, who are showing up in the emergency department for another reason. We recognize there's lots of barriers to access for folks over time, and this is a great opportunity when people show up for other reasons in the emergency department to get them vaccinated at that time. And I think that this just demonstrates how, as a community, listen to what Jake was saying, listen to what Patty's saying, the mayor's saying, that we're working through many different avenues to make sure that we maximize influenza vaccination this year to keep our patients, our family, our friends, our community as safe as possible. So with that, I think I'm going to turn it back over to Anthony for a Q&A.
Thank you very much, Dr. Lynch. And that is correct. We will now start our Q&A. As a quick reminder, please keep your questions tight. We are a little short on time this morning. We will give everyone opportunity for one question and a follow-up. I will read your names off 2 at a time, and I will control your microphones. So our first question today will come from Patrick Quinn from Como News, followed by Graham Johnson, Cairo 7. Patrick, the floor is yours.
Mayor, I hate to divert directly away from the flu shot, given how important they are, but a record number of SPD officers have left the force this year, not from cuts, but they cite local politics, some very critical of your work. I know you're aware of the exit interview comments that became public yesterday. My question, what's your reaction to those who left, and what's your message to the roughly 1,200 officers still serving Seattle?
And both Chief Diaz and I are very concerned at the number of officers that have left. One of the things that's most concerning to me as mayor is we're starting to lose the officers who are the exact officers we want to keep. Those younger officers who are new in the force, they came on under the consent decree. They've been trained in de-escalation and crisis intervention. They're diverse. And those officers are starting to leave because they see better opportunities somewhere else. I say to the ones that are there, please stay. Seattle values you. I value you. I was able to talk this week to the officer who was had the fire in his patrol car, and in conversation with that officer, it was in some ways really uplifting, because the officer told me about why they became a police officer in Seattle to begin with, and left a career that was mostly behind a desk to really help and serve people, and has only been on the Seattle Police Force for a few years. We want to keep that officer and the officers that are supporting that officer. So we will be looking at a variety of options to make sure that we continue to support the officers that we have, and to make sure that we have enough officers to respond throughout Seattle to the range of 911 emergencies that we know we still need police to respond to.
Patrick, follow up.
Yeah, just a quick follow-up. Chief Diaz said that the force really shouldn't go below 1,400 officers. Well, we're seeing that happen. And today, the City Council deliberating potential further changes to policing. My question is, how are you working with the council to reimagine policing while maintaining staffing levels that ensure public safety?
It's a great question. I meet with City Council members on a regular basis and talk to them, including on policing. And I announced last week or the week before a working group that I'm hoping City Council joins in to really be data driven and be looking at the 911 calls we get and have a great understanding of what do we still need an armed police response to. There are many 911 calls that you might need a different kind of response, a social worker, a crisis intervention people. But there's still a large volume of calls that when people call 911, they need an officer and they need them right away. And it happens 24/7 in every part of our city. So we have to maintain enough officers to do that kind of work. Obviously, those officers have to be trained. We have to continuously improve. We have to be community-based and pay attention not just to constitutional policing, but how we really integrate ourselves to be more part of community. But we still need police officers to respond to 911, and we will continue to do so even after we reimagine policing and stand up alternative forms of response.
Thank you, Mayor. And thank you, Patrick. Our next question will come from Graham Johnson, Cairo 7, followed by Carolyn Bick, South Seattle Emerald. Graham, the floor is yours.
Good afternoon, Mayor. You mentioned a few moments ago that you're looking at a variety of options to support officers. What are those options? How can you effectively balance supporting officers with rethinking policing?
So, Graham, that's a great question. I don't think you can do one without the other. First of all, in reimagining policing, one of the greatest resources we have are the officers we have. I think if you put police officers at one table and community in another table, and you set a short list of things that you would like to see alternative responses to, the list would be very similar. So we have to incorporate the experiences that we've had. And as we reimagine policing, figure out what are those things we still need a traditional armed police officer to respond to. So number one is they've got to be part of the solution. Number two is we've got to do better in officer wellness. I've been to roll calls, talked to officers, and I think that we can't underestimate how stressful the last series of months have been on every police officer, and making sure that we're giving officers adequate time off, the supports they need, the training they need. And it starts with, them knowing that their elected officials, the mayor and the city council, support them in their work, and that we will give them the resources they need to do the job in the way that community demands.
Graham, follow up.
I want to ask on yet one other topic. How close are you to making a decision regarding the West Seattle Bridge, either replacing or repairing it, leaning toward that so-called quick replacement option?
So, Graham, we're going to be having another meeting this week with the Citizen Advisory Group and the Technical Advisory Group to look at the final options that we have. As been made public, there was an option that's come up recently that didn't go through the same cost-benefit analysis, which would be a rapid replacement of the midspan that could be more quick. So we want to get more input on those. And really, the three factors that I'm looking at as mayor is, one, what is it going to cost, short-term and long-term? Two, how long is it going to take? And three, how long will it last? And so looking at those factors and getting more input from those two groups will get us much closer to a decision.
Thank you, Mayor. Thank you, Graham. Our next question will come from Carolyn Bick, South Seattle Emerald, followed by Hannah Scott, Cairo Radio. Carolyn, the floor is yours.
Great, thank you. How will you prioritize people who are, this is flu related, how will you prioritize people who are uninsured and who are experiencing homelessness in order to avoid running out of free vaccinations too quickly and therefore having a negative impact overall on people who don't have the money to pay for vaccinations?
Thank you, Carolyn. Thank you for asking that question because I want not to get lost. This program that we're announcing today really is geared to the uninsured and underinsured. And as Jake said at the beginning, we have enough vaccinations, we've obtained enough that we think that we can cover that. And so we want to make sure whether it's somebody experiencing homelessness, and we will have programs to go into encampments, into shelters, into permanent supportive housing, or whether it's just someone in the community who doesn't have access. I have to really, again, tribute the three people who are here today and the others who worked hard to get this. We learned about a month and a half ago that the normal allotment for public health vaccinations might not come until mid-November or later. We knew that was going to be too late. So everybody went to work to stand up a program to make sure that we could get flu vaccinations to people who were uninsured or underinsured as quickly as we could in all the places that we know that is access for them. And so we're working really hard to have easy access, both physically and language-wise, and also for people who might have disabilities, and also make sure that they hear about it. So thank you for that question.
Carolyn, follow up.
Yes, I also wanted to know how you're going to ensure that folks from wealthier parts of Seattle don't try to get these limited free vaccinations, kind of like we saw with the walk-up COVID testing site, the Atlantic boat ramp back in the spring, where it had a limited number of tests, but people were driving down from, say, the wealthier Capitol Hill area to get tested.
So we learned a lot from our vaccination, our testing facilities on where to put them, how to use them, who accesses them. And we think that the distribution between what the county's doing, the city's doing, the Seattle Public Schools, is that there will be enough facilities in the South that people will be able to access them when they need to, and that we have additional facilities in the north part of the city. So and people will be registering. So if we start to see that flagged as an issue, of course, we'll pay attention to it. But we feel like we learned the lessons pretty well and that shouldn't be a problem this year.
Thank you, Mayor, and thank you, Carolyn. We were going to go to Hannah Scott, but it seems as though she has dropped off the call. So we will go now to Tracy Record, West Seattle Blog, followed by Dan Springer, Fox News. Tracy, the floor is yours.
Hey, Tracy, you're on mute if you're talking.
Yeah. Wow. Cool. So anything else that people should know about this when hearing about this concept?
No, I think that the more people know, and if you put it in the blog, that'd be terrific, because I know people in West Seattle rely on that. And I want every reporter who's asked a question, the price of a follow-up is you go get your flu shot.
And with that, Tracy, do you have a follow-up? Not hearing one. We will go now.
Working as a PEO.
We'll go now to Dan Springer, Fox News, followed by Jonathan Cho, Como News. Dan, the floor is yours.
Hey, Mayor, how you doing? I had a quick question for you. I know you didn't support the bill that basically ended the navigation teams, but the reality is that since they have stopped doing their work, we have seen a lot more homeless encampments in the city of Seattle. Some of them even in sensitive watersheds like Thornton Creek, which the city has spent millions of dollars to try to restore. I want to ask what you guys are doing to, alleviate the problem in light of the fact you don't have the navigation teams anymore. And how do you respond to residents who say when they call the city for help with these encampments that they say, some of which are pretty dangerous, they say, the city says, we can't help you out.
So Dan, thanks for that question. There's no question that during the pandemic, that everything in the city has changed. And we saw early on, we had CDC guidelines that we had to make sure that it was better for people's health under the COVID emergency to not move encampments unless there was a significant public health or safety risk. We've moved only a small number of those, but we've seen an increasing proliferation. It's one reason why I would oppose the end of the navigation team, so that we could do the outreach needed to get people into somewhere safer. We're working with City Council right now to reach agreement on what does the outreach part of that look like. I also met this morning with the head of my Parks Department and Seattle Public Utilities to have new initiatives to clean up our city. We've seen an increase in everything from what we would call litter to real garbage. And so we'll be rolling out a series of programs in the coming weeks to really take stock and make it better. But I will say that with the City Council, we will continue to work with them, but we are going to need, not just for the next 2 months, but into next year, a program that we know will work, that does sufficient enough outreach to people to bring them into somewhere more safe, but that also is willing to address some of the public health and public safety impacts that these encampments can have and are having on the public. And there are occasions when those encampments have to be moved for those purposes. And so I will continue to partner with the City Council for them to recognize that so that we can address that.
Dan, follow up?
Yeah, quick one. Just how will that outreach look without the partners that are the Seattle police officers?
So we're continuing to work with the providers right now on how that outreach will work, but it will have to be much more intensive than it's been before. We anticipate that the outreach will be focused in on specific encampments. We're working very hard to ask the City Council to give us funding so that we have more places for people to come from outside, whether that's shelter or hotel rooms. We're working with the Office of Housing to free up more housing available because we know that long-term permanent supportive housing is the best solution, but we can't scale that right now. And so we have to be straight with the residents and businesses of Seattle that if we want to move people off the street, we have to do those range of services and have more places for people to go short term.
Thank you, Mayor. And our next question will come from Jonathan Cho, Como TV. Jonathan, the floor is yours.
Got it. Mayor, it was mentioned that the flu vaccine would be administered to homeless encampments across the city. So many new encampments have popped up across the city in the past few months. How many encampments are you trying to reach in the city? And ultimately, with the navigation team defunded, who's going to administer the vaccine?
So I'll let Patty answer that question, but I think that what we're trying to do now is we will partner with the community-based organizations that serve the people experiencing homelessness, both in the managed encampments like tiny house villages and the unmanaged encampments, as well as the shelters. Patty, do you have anything additional that you could add on that?
Sorry, I had to unmute myself. Thank you, Mayor. We're going to be working with our partners in our shelters and get out as far as we can go with the encampments that are in some of the extended areas. We will have to rely, because we don't always know where all the encampments are. So we will be working with partners and sending out our teams with those partners to get as far and wide as we can.
Thank you, Director Hayes. And Jonathan,
Anthony, let me add one last thing that I know because people have asked questions about it on the encampments as well as the amount of garbage and refuges. We've relied on our partners, the Washington State Department of Transportation. People don't realize it, but all of those lands that are in and around and adjoining our freeways and our off-ramps are controlled by the state. And so we have been working with them over the last number of weeks to get them to engage again, to clean up those roadways, and for people experiencing homelessness to bring them inside. We hope to continue those conversations, but there may come a time where I'm going to ask the residents and business of Seattle to join me in making sure that the State Department of Transportation does its part to address these issues.
Thank you, Mayor. Jonathan, follow up?
Quickly unrelated, Mayor, Councilmember Lisa Herbold mentioned yesterday that more than 40 Seattle firefighters have left the agency so far this year. Is there a problem here? And what are you doing to address potential morale and brain drain problems developing at other city agencies in light of all the SPD officers leaving?
So we did see, we have had a number of fire department people leave, but I talked to the chief as well as the head of the union. It was not outside of what we expected out of normal attrition and retirements, but we're going to continue to keep an eye on that because obviously all of our public safety officers, whether they're police or fire, are critical to our public safety outlook. We'll continue to work with Chief Diaz on the tools of how we retain and make sure we get and keep the best officers possible. But there's no question that we need to do more. And Councilmember Herbold, who's chair of the Public Safety Commission, we look forward to working with her because true, people left by the fire department, but it's nowhere near the attrition that we've seen in the Seattle Police Department, particularly last month. And it is absolutely clear based on my conversations that I've had with police officers at the roll calls as well as the exit interviews, that there are very specific morale reasons that those police officers are citing. And we have a duty to fix those as a city because we know we still do need police and we need those police to be engaged, to have high morale, and to be trained in the best tactics possible.
Thank you, Mayor, and thank you to all of our questions today. Want to end the press conference here with a quick thank you to everyone who joined us, Director Hayes from Seattle King County Public Health, Dr. John Lynch, UW Medicine and Harborview Medical Center, and Jake Scherf, CEO of the Seattle Visiting Nurses Association. Thank you all for joining us this morning, and that now concludes today's press conference.